Good evening. My name is Liz Krueger. I'm the state senator from the 28th district here in Manhattan, and you might be watching us from anywhere in the world. You might be viewing us on Zoom or Facebook or even calling in. Our discussion tonight will be about the impact of COVID on your mental health. I would like to start by thanking my colleagues who co-sponsored this event with me this evening. That includes Manhattan Borough President Gail Brewer, Congresswoman Carolyn Maloney, Senator Brad Hoylman, Assembly members Dick Gottfried, Dan Court, and Rebecca Seawright, and council members Ben Kalos and Keith Powers. Before I get to today's proceedings, I want you to be aware that we have closed captioning available. So as a viewer, you have to activate closed captioning to view the text on your device. If you're on Zoom, click on the CC button in the meeting controls to start viewing closed captioning. If you're on Facebook Live, you'll see a setting button on the bottom right-hand corner of the video. Click closed caption, again, CC, to start viewing closed captioning. I'll just do a few announcements before we begin this evening's program. COVID-19. Can't get away from it, can you? So we have hospitalization and fatality rates continuing to increase throughout New York State and the country. The governor has presented a winter plan to help fight the virus until the vaccine is available and can be administered. Please continue to wear your face covering and practice social distancing. The New York City Health Commissioner is advising older New Yorkers and people with underlying health conditions to stop non-essential activities. Stay in as much as possible and avoid social activities outside of your household. This does not include going to medical appointments and getting tested for COVID-19. You should continue to get tested if there's any concerns at all, and don't skip your medical appointments. Overview of this evening's event. New Yorkers have been living with COVID-19 virus for months now, I think almost 10 months, and we're facing a second wave of the virus. Many of us are worried, anxious, and those of us who lost loved ones or lost our job or are recovering from the virus may be experiencing significant mental health symptoms for the first times in our life. In fact, I question whether anybody has the same mental health standing that they did a few months ago, because there's no way to avoid being impacted by so much of this coming at us at the same time. At this town hall meeting, we will hear from experts about the impact of the virus on our mental health and about Project Hope, a new federally funded program designed to address these issues. Today, we will hear from Stephen Moskowitz, Director of Emergency Preparedness and Response at the State Office of Mental Health, and from Doug Ruderman, Director of Project Hope, a new federally funded program designed to address the mental health impacts of COVID-19 among counties hardest hit by the virus. After their presentation, I will moderate a Q&A portion of the event where we will be joined by Dr. Lisa Dixon, a psychiatrist at Columbia University Medical Center and the director of the Center for Practice Innovations at the New York State Psychiatric Institute. So I'll be back after the presentations. It is now my pleasure to welcome Stephen Moskowitz and Doug Ruderman. Good evening, gentlemen. We seem to have, oh, here we get Doug back.
Yes, I think that Steve lost his internet is the note I got on Teams. So if you give me, I apologize 1 second so
Sure.
I can pull up the presentation PowerPoint and share my screen with you.
That's what happens with live things. Things go wrong and you ad lib, so no problem.
It'll be just one moment.
Sure.
Okay. No, I have-
Okay. Seeing it.
Do we have it now? Does everybody? see
Yes.
it?
Yes,
Okay.
I can see it.
Well, I will do my best to represent Steve's portion of the presentation, which I have not practiced, but I will do the best that I can. Good evening, everybody, I guess now. I'm Douglas Ruderman. I work with the Office of Mental Health, and I am the director of Project Hope. And I'm happy to be here to talk to you a bit about Project Hope and some of the issues that we're going over. As the senator just said, it is hard to find anybody who has not been impacted by COVID at this time. And in fact, when we did a needs assessment, which was required to be done in order to get funding for this project, and I'll talk a little bit about that later on, we're up to almost 8.5 million New Yorkers that fell into the categories that allowed us to achieve the funding from FEMA, which is about $106 million grant that we received to start up this project.
Doug, I'm sorry to interrupt you. Could you set your PowerPoint so that it's we're viewing the whole slideshow? At the moment, we're seeing multiple slides.
Oh, I'm sorry. I thought I had done that. Let me see how display setting. I apologize. Let me unshare and then try to reshare and see if that helps.
Doug, if you'd like, I could toss it up. My internet has come back online.
Please do.
My apologies to all for the challenge that I had there with getting my internet to work with us. How are we looking?
Looks good.
Okay, well, hello, I'm Steve Moskowitz, and I work with Doug Ruderman at the Office of Mental Health. My day job is that I oversee a Bureau of Emergency Preparedness and Disaster Response for the agency. And one of the things that I get to do is following major disasters, the Office of Mental Health provides New Yorkers with mental health assistance following the event to help mitigate the consequences and the impact of those events. So the Crisis Counseling Program is one of those programs that the Office of Mental Health operates, and that comes out of my office. And on this particular grant, I'm the principal investigator, and I get to work with Doug on implementing the program. So a little bit about what the impact of a disaster event, and COVID-19, make no mistake, is considered a disaster event. Disasters create stressors. One of the ones that is particular to a biological event, to an infectious disease event, is that different from a hurricane that we watch on TV, we could watch it roll up the coast and have it impact us, or a winter storm. An infectious disease outbreak is invisible. We can't see it. The impact on it, on us and on the world around us, is not predictable. The consequences of it are not easily discernible, and we are all living through these extremely uncertain times, not knowing what's going to happen next, when COVID-19 is finally going to round a corner and leave our lives and let us return to a more stable existence. And it keeps changing. And the result of all of those dynamics is that we are constantly in a position where we need to continue to adapt our behaviors, our way of thinking, and our responses to what we're being presented. That in turn ratchets up our stress levels, and we all carry a certain level of stress. We do it all the time. Every single day presents stress of one type or another. It's whether we're going to, the alarm is going to go off in the morning, or whether we're going to remember to attend all the meetings that we have scheduled, or whether the kids are going to be taken care of today, any number of things. And we live with that. What an event like COVID does is that it ratchets up, it layers on top of all those normal stresses, something new, something different, and it's challenging. So some of those stressors, well, there's the medical ones. Am I going to get sick? Are the people I care about going to get ill? If they do, what am I going to do about it? How am I going to manage it? What if people that I care about get sick or, heaven forbid, pass away? All of those, whether they are occurring or not, create stress. At the same time, not all of those stressors are medical in nature. Some of them are very practical. Some of them have to do with things as simple as, is there going to be enough medical resources to pass around? If I get sick or my family gets sick, what's going to happen to the education for my kids? Or will I still have a job? So some of these are economic. There's a lot of work-life balance issues that we struggled with before COVID, but now that many of us are working from home, that line of balancing a work life and our personal life is getting blurry. And it means that when things are not clear, we don't see a road ahead. It's another layer of stress. We have social concerns. We don't see our neighbors the way that we used to when we walk down the streets. Things are different when we go into a grocery store. Every aspect of our social environment has been impacted as well. All of those things, all of those stressors generate reactions. And the reactions that we people tend to have cross a very broad continuum. It could be moods, and it could be that I'm very sad or I get angry. It could be that I'm scared. Many of these are emotional responses, but there's also physical ones. I may become isolated. And for sure, I'm going to be stressed, overwhelmed. That can affect us cognitively. Our thinking can become strained. We can be frozen into inaction, or we may find ourselves manic and wanting to do a million things because no one thing seems to be changing things or making it better. And to all of those things, the most important thing to hold on to is the fact that those are all reasonable reactions to very, very challenging circumstances. New York Project Hope is designed to help New Yorkers with all of those reactions through a number of activities. So we provide crisis counseling, and we have a number of ways of providing people with crisis counseling. One of those is through our efforts on administering and running the New York State Emotional Support Helpline, a helpline that is functioning 7 days a week from 8 a.m. until 11 p.m. There'll be more information about that later on a slide. We also are engaged with local providers of social services in counties across New York State who will be looking at programming from the local level. And in those activities, they will look at doing things like providing public education, psychoeducation, so that people understand the circumstances that they're confronted with. They'll provide coping techniques and suggestions on where people can find resources and assist people in connecting to those resources. And the bottom line on all of the services of New York Project Hope is that all of them are free, they're confidential, and that participation in any one of those activities is completely anonymous. So to give you a little idea about, out of all those things, what exactly is the impact of it? Well, crisis counseling helps people recognize that their emotional reactions are reasonable and to help them develop coping skills. They're going to use those skills then to hopefully return to that place of pre-event functioning, some equilibrium in their lives, something that is challenging at this time. And our crisis counselors are trained to work with people and to help them through those steps. I mentioned public education, and that comes in many different forms. We have a primary website called newyorkprojecthope.org, and we support a number of various social media platforms where we offer information to help people understand their situation. We offer resources on how to do any number of things either directly related to COVID. So it may be the latest guidance on wearing face masks or where to get testing, but it could also be related to some of the challenges that people have that are related to the impact of COVID, like food insecurity, unemployment, childcare. So all of that information is part of a resource section on the website. There's also a section on coping with techniques, relaxation exercises, and suggestions on how people can problem solve, where they can go under resource linkages, where they can go in their own community to find help beyond what they're getting from that website. Through crisis counseling, we help people with a number of various specific things that help them regain that that sense of mastery and control over their situations. So we help folks understand, to identify and label some of what they're feeling, to give them that sense of getting a handle back on things. Sometimes it's helping people adjust to the fact that there are real losses. We have lost a way of life. Some people have lost loved ones, some have lost their health. So there are very, very realistic losses that are tied to this, and we help people adjust to those by developing coping strategies, by teaching folks how to manage the stress that they feel, and once again, by connecting people to resources within their own communities. There's a pretty significant difference between crisis counseling and traditional counseling, which is very usually, it's going to be office-based. It focuses on diagnosing and treating mental illness. It looks at the content of what is bothering somebody or what a presenting challenge is. It looks into an individual's past and where they come from and what they've experienced previously. Crisis counseling, on the other hand, is community-based. In our response to COVID, it is entirely virtual. But with crisis counseling, we really just take people at face value where you are at the moment, and we try to focus on what works for the individual using the natural strengths and resilience that they've used their whole lives to deal with challenges previously. And the program collects no identifying information on the people that participate.
All right, Steve.
Over to Doug.
Yes, thank you. So I introduced myself earlier. So again, I'm Doug Ruderman. I'm the director of Project Hope. I've done a number of different things here at the Office of Mental Health in the past, and I'm very happy to be participating in this project now. Now, some of the things that I'm going to say are going to be a little bit redundant because I want to stress some of the stuff that Steve spoke to, but I wanted to make it clear when we have a statewide program here of public education, of media outreach and engagement to try to get the information to as many New Yorkers as possible. And our emotional support line, which is something that we've never really operated before in other disasters, um, was put in place simply because when we started this, we really didn't know where we were going to be regarding, the openness of New York State, whether or not we would be able to actually do the traditional activities of a crisis counseling program, which oftentimes meant that you were knocking on people's doors and seeing if they were okay and if they needed assistance. Their house was flooded. Something may have happened due to a natural disaster or some other disaster, and we were there to try to provide some support. And it was a pretty kind of evidence-based way of going about things. So the first thing that we did was we determined that we really needed some type of a virtual crisis counseling program. And that's how we, at the governor's behest, really came forward and started with a voluntary emotional support line that eventually our program, which is funded by FEMA and administered by SAMHSA and managed by the Office of Mental Health, came to be. And it eventually transitioned when we got funding from FEMA to a crisis counseling program, emotional support line. And that's available throughout the entire state. But in addition to that, we're going to talk a little bit about some of the community programs. And there were this 5 boroughs of the city of New York and then 7 other counties, Nassau, Suffolk County, Westchester, Rockland, Orange, Dutchess, and Erie County, which at the time when we wrote this grant were the most heavily impacted by virtue of infection rates and unfortunately mortality rates. And those are the 12 counties, the 5 boroughs and the 7 counties, in which we have in community crisis counseling programs that will be operated by community agencies. And those in New York City should be up and running beginning as early as in a couple of weeks to throughout the month of January. And there'll be about 20 agencies or so that will be providing services, and we'll let you all know who those agencies are when they're all ready to go and they're signed up and they have contracts and staff and things like that. Next slide, please, Steve. So a little bit more about the emotional support line. And I just wanted to clarify that it is available from 8 a.m. to 10 p.m. You'll see the phone number here on this slide, 7 days a week, because Steve had mentioned 8 to 11, and just want to make sure you understood it was 8 to 10 p.m. And to date, we've received about 40,000 phone calls on the emotional support helpline. Right now, and because these numbers change from month to month, they were very high in the very beginning of COVID, March, April, May. The numbers were, upwards of 8,000 calls in a month. To in the middle of the summer, when the infection rates were further down and people were out of their houses and getting around and things seemed to be getting a little bit more normal, we were down as low as maybe 3,000 calls in a month. And now with the infection rates rising, we're up to about 5,000 calls per month, and every week that the number of calls increases. And we can really see it gauging itself and marking itself to what's going on regarding the infection rate and the weather, one or the other or both. So if you go to the next slide, please. So a little bit more on public education. We're very proud of our website. Please go to it. There's a lot of information there that can link to you. We think it's consumer or community oriented. It's easy to navigate. It's pleasant to look at. There's some interesting things like these coping tips that we put a different one up every day. We have other resources that are available there, and we'll also have a directory on the website once all the community programs begin, so that if you were seeking, let's say you lived in Manhattan and you were looking for a crisis counseling program in Manhattan to speak with, you'd be able to go to, the county or the borough of Manhattan, the county of New York, and up would pop all of the crisis counseling programs, how to contact them, how to reach them, what their hours are. Other information about them will be available on that website. We'll also have links on that website to a number of things that the Center for Practice Innovation is working with us. And Lisa Dixon, who's with us and maybe help us answer a few questions later on. She's the director of the Center for Practice Innovation at Columbia University, and they do a wonderful job putting together learning modules and information, typically for professionals. But in this case, what we've done is we've also engaged them through the grant to come up with information that is going to be accessible through the website. So there'll be some animations to begin with, probably in the month of January or so, in which you can go to and get more things on coping tips and different exercises and different ways you can deal with how you're feeling. If you're choosing not to reach out to a crisis counseling program, you can certainly go there and get some support and some help. And then we're also going to have some learning modules eventually when they're finally produced, that are going to kind of approximate the experience you might get if you actually went to a crisis counselor and got crisis counseling. Because we know not everybody wants to really reach out, even though it's anonymous, and we try to make it as easy to access as possible for you. Some people may not be interested in that, and so we're trying to come up with other methods where you can get similar support. Next slide, please. So creating community partnerships, that's one of the big things that the community crisis counseling programs can do that our emotional support hotline certainly is not really able to do. These agencies are in your communities. They know who you are. They know who your neighbors are. They know who your businesses are. They know who your social supports are. They know who your politicians are. They work every day in your community. And so we're going to be asking them to reach out and build alliances with your libraries, with your houses of worship, with your schools, with your businesses, with your laundromats, wherever they can get to get information out so that we can outreach to you as best as possible. And that's going to be one of the first charges that they're going to have, because there's no way for you as a public to really reach them unless if you know about them. So we have to do a lot of outreach and engagement, and we're going to try to do it in that way. We're also going to be using other associations and coalitions and other organizations, and I think I talked about this on a later slide, in order to kind of amplify our message and to try to get to more and more people and let them know about us. So the next slide, please. So resources and linkages. We are going to have, as I said, on our website, we're going to have a click to contact way in which that you can reach a crisis counseling program in your area. And when you do get to those crisis counseling programs, they will be provided with information in which they can share with you where you can get help, everywhere from what I call soft services, which are more like perhaps traditional counseling services or other types of support services, to hard services. How do you apply for health insurance if you lost your health insurance? Where can you get food? Where's your local food pantry? Is there a warming station? Is there something that is available in your community that might be of help to you? They're going to build up a inventory or a library of that information to share with you. Um, and we also have been reaching out, and this is what I was speaking to with other organizations. So one of the big ones that we've spoken to is the PTA Association. So through them, we were able to get our information out to all of the PTAs in all of the school districts in New York State, and to reach into all the school districts in New York State. And in New York City specifically, there are going to be a few agencies for those of you that have school-age children that are specialize in working with the schools. They work in schools now, doing other kinds of counseling services and in-reach into schools. And some of those are going to be identified to provide crisis counseling services for families and for children and youth. So next slide. So what we will be doing with our community crisis counseling programs is we're going to be following the local and state guidelines. And that's why I say things are different and things are also going to be flexible. We're going to be moving back and forth as the level of infection or the immediacy of vaccines come forward. It'll change the landscape of how we provide services. So right now we're going to be limiting person-to-person contact, following stay-at-home or shelter orders if they are available. So we'll be providing a lot of these services remotely by the telephone, using platforms like these platforms that we're using tonight, and we're manning or providing all of these crisis counselors with the technology that they need in order to do this. But they can also, you can just use a regular telephone and call somebody if you need to do that also. People do not need to have this kind of technology. They don't need to understand how to use the technology. There are a lot of different ways to reach us. We're also going to make sure that staff use whatever PPE they need to use when they're in the community. They're going to follow all the rules once they go into the community, if that's allowed. And we're asking all of the program leadership, every program has a program coordinator, to make sure that they're up to date with the latest from the CDC and from SAMHSA regarding this. So we've also provided, next slide, please, some key resources for you. And so here are some numbers and contacts that you can avail yourself as to get other support. We're not the only supports available in the community. So, here's a listing of things that you might be familiar with, like New York City Well or Access New York. We have a link on New York State unemployment. We've gotten a lot of calls from people who have applied for unemployment, and they see our link there, and then they reach out to the emotional support line. So here's some resources for you. Next slide. And we'll also, if you feel like you need it, or if we feel like you might benefit, we might recommend a referral for traditional treatment. Again, I think, as the senator said earlier, there are a lot of people that might need that kind of support that never had before, because they're being confronted with issues that they never suspected they would be confronted with, and they're trying to cope as best as they can. But sometimes these things that we've talked about in crisis counseling and other things, which are not clinical services, are not enough for somebody. So it's okay to reach out. Most people have insurance. They have most insurance in New York State is in managed care now, whether it be commercial or it be a public insurance option like Medicare or Medicaid is enrolled in managed care. So we, also will recommend that you speak to your insurance provider so that if you do want a referral for treatment, that you get treatment and you don't have to worry about how it's going to get paid. You can ask for a list of network providers. We know that that's frustrating sometimes because not all network providers are always accepting new patients. But what we found in the mental health world is that we have very many different modalities to provide treatment now. We can do a lot of telemedicine, teletherapy types of treatments. You don't have to be concerned about going to people's offices. Many practitioners offer telemedicine, teletreatment, and you can do that from your home if you're concerned about going into the community to get that kind of support. And also, if you speak to your primary care provider, they oftentimes can recommend referrals to you. Next slide, please. So here is this QR code on this slide to try to make it easy. If you do get the slide, I don't even know if you put your phone up to it right now, you might get right to our website. So we're asking you to visit our website. As it says, we have resources there. We have coping strategies. We have relaxation tips. We have a lot of things that I think would be helpful for you. And I think I concluded in time for questions and answers.
That's perfect. Thank you so much. So we have a lot of questions that came in advance, and there's a few that have come in since we have been talking to each other this evening. So I'm going to try to throw some of those out at you, and of course invite Lisa Dixon to join us again, and maybe Steve Moskowitz also take yourself off mute. Perfect. And you're back with us, and Lisa Dixon is also with us. Welcome, Lisa.
Thank you.
And so I will, throw a question out, and whoever of you think you're probably the best one to answer, feel free. This seems a very relevant one for so many. So what if I had a pre-existing mental health condition and I'm feeling like a little churlish that now I'm complaining that I'm also suffering from the new layers of anxiety and completely overwhelmed with COVID. So is there anything special we should be thinking about if we already had a history of mental illness before we even knew what COVID was?
Do you want me to take that or at least start? Or Lisa, do you?
Entirely up to you.
Well, I'll start, and then if somebody wants to add in, hopefully if somebody has a pre-existing condition and they've needed some assistance in the past, that they're connected to some support. And it doesn't have to be your traditional licensed treatment provider. There can be lots of different ways that people learn to cope with their feelings and their what's going on. Exercise, close relationships with people that they can speak with, and other things. But I understand that especially with isolation and other things that could come forth, and maybe a disruption in treatment because of COVID, that people might need more support. And what I would say is, if you have trusted treatment providers, trusted helpers, relationships, friends, supports, that you should try to access them as best you can. And that if for some reason you're having difficulty getting a hold of those support networks that usually you rely on, then call the crisis counseling program, call our helpline, and maybe we can help redirect you to some new supports.
Okay, thank you. Okay, so this is a classic District 28 question. I always point out to people who don't know us so well here, like everyone in my district went to college and a good half of them went to graduate school. So we get some pretty sophisticated questions. So for example, I just read a neuro study about social isolation, finding that the parts of the brain triggered are those of physical hunger. Can anybody help me understand that?
Should I point to the doctor? Or
Absolutely.
Well, I have learned that many people in the community know far more than I about certain aspects of human behavior, and I think it's a great question. And I actually would be, I mean, I hesitate, but if I'd be happy to try to connect with some folks at Columbia where we have lots of people who are neuroscientists and try to get an answer.
Well, that's great. So we'll give Lisa some time to ask. And then Wendy or Dawn in my office, and everyone who's watching probably already knows how to find Wendy and Dawn in my office. If you reach out to them, they'll be able to help you answer that question, perhaps.
Yeah, and if I may, just from a layman's point of view, when I'm stressed out, I get hungry. They call it stress eating, right? So I don't know if that's just now they're finding it's happening more frequently, but that's just my layman's without any Columbia University behind me perspective on that.
I certainly identify with that issue, and everyone is joking about COVID-19 also means a 19-pound weight gain during this period. So I do think that there are some correlations that we may not know the science behind. All right, coping, how to cope. I'm having difficulty managing my anger when I go outside and see that many people are still not wearing their masks or social distancing. I often have to walk down the middle of the street in order to avoid close contact with people who might expose me to the virus because they refuse to follow even the most basic protocols for stopping the spread of COVID. Aside from locking myself in my apartment, what can I do to cope with the sense of rage that I have? I hear this one all the time, folks. You're not alone. Besides telling you you're not alone, how can we manage the extreme reactions we may have to things going on? Because probably most of us don't think we're going to go into a rage every time we walk outside.
Steve, do you want to?
Well, the one of the very common reactions that we can expect is anger and frustration, and rage is just kind of down the continuum on that anger scale. It's also reasonable, and just to return to something we talked about in the slideshow, some of these reactions are very reasonable reactions to situations that are not at all reasonable. So to understand that sense of emotion that wells up, to understand that that's not an uncommon or an unreasonable reaction is one step to understanding yourself. The second piece would be, once you can recognize that, to look for ways to try to mitigate that emotional welling up. So that could be anything from behavioral techniques where you might practice breathing exercises, or it could be a cognitive technique where you look to try to do some self-talk, where you walk yourself through the situation and then try to rationally work through what the behavior was, what your reaction was, and how you would like to act. So it could be, distracting yourself once you recognize that is going on. So this is one of those places where, our website again has pull downs that can take you to any number of various exercises that fit you, that work for you, because all of us find comfort in different ways of coping with things.
Thank you. So several people referenced believing that meditation and chanting might be a good way to help relieve stress, but are wondering where you would find something like that, since you have to do it from your own home. Do these websites that you are operating have lists of services such as meditation?
I'm not sure if we have anything specific regarding, whether it be meditation, yoga, chanting, any number of things, but I think that's a great suggestion. And if any of the people listening have other suggestions, please send them in and get them to us, because I'll talk to our emotional support line and I'll say, if we don't have that kind of information, let's look into getting it and making it available.
Great. And I recently did a senior resource fair online, and one of the days, it was a 3-day event, and one of the days was around, using physical exercise and wellness to help you feel better during these times. And we had a couple of terrific people who use meditation. So obviously they can't be providing services statewide, but if you live in my district and you actually want referral for meditation online, I think that we already have a few that we've banked, so to speak. But certainly some people find this incredibly valuable in helping to, moderate anxiety, even keep control of, their heart and blood pressure. There are many things that meditation and chanting can help people with if that's where they choose to, explore. So I do want to make sure that even if these websites tonight don't have this information, please feel free to reach out to my office, because I think we may have some of this at least available on the local level. So New York City does have a lot of different resources. Those of us who live here know that. But the challenge is having to convince someone that that they want to take advantage of these resources, because you can see that they're suffering, and yet you can't convince them to take the step to try to get help. Is there a specific approach any of you would recommend if we know that we have family, friends, neighbors, loved ones who could really use the help, but they're not willing to call the phone number or go on the website? What do we do then?
I don't know, Lisa, do you want?
Sure. Yeah, I can try to, I mean, as a family member, I have a family member with severe mental illness, so I'm very, this is a classic situation of a caregiver or a family member. And, you never want to get into an argument. You never want to say that somebody's wrong. It's about connecting either with the person, maybe offer to go with them, or to, kind of normalize it. Sometimes, identifying peers or people who are colleagues or friends that may be getting help themselves can be helpful. I think, again, just being very non-judgmental, being very caring, and I think, there's no magic solution here, but what you don't want to do is sort of get into arguments and sort of just say you're right and they're wrong kind of thing.
Mm-hmm. And you don't want to go and take the step to have someone call them and say, hi, I'm the mental health counselor. I heard we should talk. That would not be the right approach.
No, thank you for making that clear. Because then the person would feel, that their trust and their privacy in some sense has been violated. Obviously, if someone is in a situation where it's dangerous, or there's a very, very heightened level of concern, that's a different situation. But if that's not the case, then I think you want to try to respect the person's autonomy, and remember that I'm not saying you should bug the person, but you can be persistent in a gentle way.
I was asked the other day if I thought or if I knew whether there was a jump in substance abuse by seniors during this period, because it was basically people self-medicating in this very difficult time. Do we know, are professionals actually seeing a growth in substance abuse by older New Yorkers?
We could get that information for you. I know that substance abuse has gone up, the incidence. I don't know if it's by age, population, whether or not it's there's something different with people that are senior as opposed to everybody. But everybody in general, the number is going up, but we can follow up and get more information for you.
My bet is that it's a safe assumption that it is. It may not be to the extent, but I mean, this is really something that's happening, I think, certainly across many elements of the population.
And are the counselors on your phone lines trained to, deal with someone who calls up and says, I think I am abusing drugs. I can't get control of myself without taking more than I know I'm supposed to? Will they refer people to the right kind of, hopefully, service if they hear that from people?
Steve?
Yes, they will. One of the key parts of the training for the crisis counselors, be it on the helpline or the ones that will be part of the local provider programs, their training is to assist them in identifying behaviors, to listen carefully when people talk. And if they do get that information, they're trained and ready to provide references and resources to refer someone to receive assistance.
Got it. Thank you. Okay, so while this was a question, I'm going to just shift to making it an answer. Someone asked about, are there conversation buddy options for seniors where somebody will call in and check in on them? And I'm just going to answer the question because we have so many more to go, which is, yes, here in New York City, there are a number of different programs available that arrange for volunteers to call New York City older adults and to check in with them. And if you were interested in finding out how you can get that help for yourself or others, call my office tomorrow and we'll email you the information. Oh no, we're just going to email everybody the information following the event. So we're going to provide that information to you. You don't even have to call us. But that we've found is also a really important role we can play as volunteers in our community, or as people who, need someone to check in and make sure that they're okay and double check everything. So, happily New York City does seem to have a number of programs set up for that. What if a next door neighbor is causing you stress because they're not following the COVID guidelines? Not so different than when you go outside of the house and you feel rage. But is there something you can do that someone will step in to help? And we were talking about this because I'm not sure it's a mental health question, even though it may be your mental health issues that are triggering such aggravation with your neighbors. So our recommendation is you speak with building management. Might be neighbors who refuse to wear their masks in the elevators, even though they're supposed to, who are not following social distancing rules, even though they are supposed to, etc. So you can talk to the building management, you can talk to the tenant association, you can ask them to reinforce through putting posters up, what the rules of the road are supposed to be inside of multifamily dwellings. A number of you live in upstate New York, but all of us down here live in buildings with lots of other people, and we can have issues of, people don't want to follow the rule. There shouldn't be more than 2 people in an elevator at the same time. They don't like to have to wait, but it's actually quite important that we do get the buildings to reinforce these rules to protect everybody's safety. And there's even a more formal way for people to let the government know if they think that quarantine rules aren't being followed, and they might be aware of that. And so they can actually, through web or phone call that in, and we'll give that information out to everyone post the meeting as well. Okay, what is being done in partnership with Department of Education to make sure the mental health needs of our children are being met? Our format tonight was discussing the issue for older New Yorkers, but of course, this program, this project is across the board. It doesn't matter what your age is. So have you found models that are working in the school systems anywhere in New York?
Well, in New York City specifically, we're working with the New York City Department of Health and Mental Health on this program, and they're going to be managing these 20 agencies in New York. And as I said, there are 3 agencies that are really expert at working with the school districts, and in partnership with the Department of Education in New York City, the Department of Health and Mental Health are going forward. We also have a number of subcommittees that are kind of overseeing how we manage this program. There's a steering committee that's led by Commissioner Sullivan, and is co-chaired by Hillary Kunis at the New York City Department of Health and Mental Health. But we we also have a subcommittee specifically on children and youth, and
Yeah.
there's associate commissioner from New York City Department of Health and Mental Health on that subcommittee, with our associate commissioner in charge of children and youth here at the New York State Office of Mental Health. And we do have a model that has been followed in the past that will have to be adjusted to try to work with kids that and families that are at home or are in a hybrid school situation or some other situation. But we are working very closely with the Department of Education in New York City around this.
Thank you. So I think the last question, which I think I will try to answer. My mom is 97, locked down her nursing home in New York City. It's been horrible being isolated. How can I or the psych professionals crusade to get in-person care? I am COVID negative and would wear PPE. And this is a constant issue we get called about, every elected official, that family can't go see their locked in older and frail family members. So I do want to say a couple of things quickly. One, there is a bill, Senate Bill 8958, and would authorize Department of Health to develop regulations to allow personal care visitation for the provision of care and compassionate care for family members in nursing homes and other residential treatment facilities. It would allow family members and legal guardians of residents, nursing homes and other residential healthcare facilities to visit. It would allow a person to be named the outside, authorized to come visit person at these facilities. And of course, probably most relevant, hopefully even quicker than legislation at this point, the vaccines are coming, and the governor has already announced today that first priority for making sure people are vaccinated are healthcare workers working in hospital and residential settings and people who are living in nursing homes and other residential settings. And so, of course, if we can get our arms around not having to worry about COVID spreads in our residential facilities and in our hospitals, there will be all kinds of reasons that we can, quote unquote, get a little more comfortable with not everyone being under lockdown all the time, which matters for their mental health as well as just, I've heard too many experiences now of people not even being able to go in and see their parents before they pass away because of the rules, which I understand we have to have, but the rules that they're not going to be allowed to do that. We've actually won overtime, so even though we didn't get every question done, so I want to thank so much our guests for spending the time with us. So Lisa, Doug, Stephen, thank you very much for participating tonight. I just think these issues are so important and can just be continually talked about, but hopefully everybody listening feels like you now have some places to go to get access to help for yourself, to learn more information about resources that are available, of course, people know, and please remember, you can always reach out to me and my office by email, by phone. We're just not really doing in-person visits so much right now. Our next scheduled event will not take place until January. We're taking a break for a little while from these, but on January 21st at 10 a.m., it will be our first session of our series we call the Senior Roundtable Series, which also won't be in person this year. But the first event is around being mortal in the time of COVID. So it will continue around the overlapping issues of confronting COVID and the best ways we can plan for, prepare for, and cope with that reality. I'm wishing you a healthy and safe holiday season, whatever holidays you might participate in. Please remember, wear a mask, social distance, wash your hands, and next year will bring us the vaccine, a new administration in Washington, and I know it's my hope for a better 2021. So thank you again for everyone participating here tonight.
Thank you.
Bye.